EHR and patient engagement. Overview of implementing an EHR. Why to implement an EHR? The finance cost of implementing the EHR. How it improves the clinical care. Accessibility between physicians and patients. Why we are implementing an EHR. The real-life cost of implementing electronic health records, also known as EHRs, is an average 5-physician primary care practice operating within a large physician network committed to network-wide implementation of electronic health records is about $162,000 with an additional $85,500 in maintenance expenses during the first year. Costs vary depending on whether you select an on-site EHR deployment or web-based EHR deployment. Web-based EHR deployment, known as software as a service, typically requires providers to pay a fixed monthly subscription cost. On-site deployment typically requires providers to pay for ongoing costs to support and manage on-site data servers. To estimate how much EHR ownership will cost your organization, you should consider the 5 main components of EHR implementation. These cost components relate to ambulatory primary care settings as opposed to hospitals, which may have different cost structures. Varying costs of implementing an EHR. Hardware, EHR software, implementation assistance, training, ongoing network fees, and maintenance. The pros of implementing an EHR is that EHRs and the ability to exchange health information electronically can help you provide higher quality and safer care for patients while creating tangible enhancements for your organization. EHRs help providers better manage care for patients and provide better health care by providing accurate, up-to-date, and complete information about patients at the point of care, enabling quick access to patient records for more coordinated, efficient care, securely sharing electronic information and patients and other clinicians, helping providers more effectively diagnose patients, reduce medical errors, provide safer care, improving patient and provider interaction and communication, as well as healthcare convenience. Some more pros include enabling safer, more reliable prescribing, helping promote legible, complete documentation and accurate, streamlined coding and billing, enhancing privacy and security of patient data, helping providers improve productivity and work-life balance, enabling providers to improve efficiency and meet their business goals, reducing costs through decreased paperwork, improved safety, reduced duplication of testing, and improved health. Some cons of implementing an EHR would be electronic health records, when not properly secured, can facilitate identity theft. Training and support from your EHR software developer or vendor will help your staff become expert users, boosting staff productivity. Quick access to patient data means your staff can process everyone faster, enhancing patient care. It's unwise to rely on EHR data in your practice without having a robust backup plan in place to keep things running, even after a catastrophic local server failure. Privacy is a major concern when it comes to electronic health records. Using EHR software can potentially put your organization at risk if you do not follow privacy protocols to an exacting degree. While paper records also make it easy to violate a patient's privacy, the convenience and immediacy of electronic records makes it easier to violate privacy at an unprecedented level. Cons continued is that identity theft can occur when unauthorized people gain access to confidential and sensitive records. An unscrupulous person could access patient data and use it to commit fraud. However, EHR software alone is not to blame for such an unpleasant scenario. After all, it's possible to commit identity theft simply by accessing paper records of patients. Data loss is a major issue when it comes to electronic health records. A computer crash could wipe out vital data that you've been accumulating for years, jeopardizing your staff's ability to ensure continuity of care for all patients. Accordingly, when you use EHR software, you also must put into place a robust backup plan. Many practices opt to conduct off-site backups of their data through a cloud computing services provider. Even if your local servers suffer a catastrophic crash, you will still be able to reconstruct your patient's information through the backup in the cloud. Some of the benefits of having the EHR system is that EHR systems are designed to make things a little easier for both the staff and patient, and to also provide a better care for the patient. EHR method is easier because it can correct misspelled words automatically, unlike the pen and paper method. It also eliminates the chances of losing a patient's file. This method is made to help organize and find information quickly to help make appointments run smoother. Paper documents with patient information should be either shredded or stored in filing cabinets with a lock. Storing the paper copies in a filing cabinet will help if a doctor or a nurse needs to review or check on past information on the patients that's not in the EHR system. Shredding the paper documents will help eliminate the problem of having the patient's privacy information getting out into the public. The benefits continued would be EHR systems are able to send out reminders of upcoming doctor's appointments as well as reminders of prescriptions being ready for pickup. Physicians and nurses are able to simply carry a tablet around at each appointment, making it easier to view and update the patient's information. E-prescribing is made to help the patient cut back the time of having to drive to their local pharmacy to put in medical prescriptions. The patient is able to access their medical account at any time for any reason, making it easier for them to send in prescriptions if needed. It shows the patient what kind of medication they are on and why it is needed. Accessibility of the physicians. It enhances, by having the EHR, it makes it more accessible with the physicians because it enhances patient care by being able to view health records from anywhere. Physicians can care for a patient over a long distance. That's basically what that means. EHR can be used to send text reminders for drugs, which can increase health benefits and compliance to physician orders. And it can allow multiple institutions and physicians to have health records at the same time, which in turn saves time and it is more efficient for the physician and the patient. With accessibility of patients, it improves the physician and patient interaction so they are on more of a connected level. So they're not at the same level, but kind of they have a relationship with each other. And it allows the patients to view health records on their own accord. And their health records can be accessed from anywhere. They can access them on their tablet, desktop, smartphone, and even at the doctors as well, because the doctors will have their records on tablet and be able to show them. Patients can be more aware of their health with the medications they are on, understand what diseases they may have, and any other health-related issues that they may have beforehand or that may come along or what may run in their family. And it ultimately fulfills the goal of a physician. The only potential problems of implementing EHR is what we've already mainly discussed, would be the cost. Cost of implementing an EHR can get pretty expensive when you start thinking about the backup plans and all the security that you will need to completely run your EHR system and to keep it safe and to keep your patients' records confidential and make sure no identity theft or fraud can come to them. Also, that falls into the system could be potentially hacked, and if it is hacked, what kind of plan do you have in place, which can also lead back to cost because it could cost you money. But one of the things when you do first initially implement the EHR, it disturbs your workflow, which means it's like it'll slow down the workers because it's something new, something they have to train for, something they have to get used to. So while it is first being initially implemented, you have to be ready to have the workflow slowed and disturbed from the EHR. And that is all.